If you're on Medicare, you probably don't spend much time thinking about how Medicare pays your doctor. But maybe you should, because there's a growing concern that Medicare payments to physicians simply aren't keeping up with the cost of providing care. According to the AMA, American Medical Association, when adjusted for inflation in practice costs, Medicare physician payments have fallen approximately 33% since 2001. At the same time, the cost of running a medical practice, staffing, technology, equipment, and regulatory compliance has continued to increase. And here's something many Medicare beneficiaries probably don't know. Physicians are the only Medicare provider type that does not receive an annual payment update tied to inflation. So why should patients care about any of this? According to the AMA, these financial pressures are making it harder for small, rural, and independent physician practices to remain independent. That can lead to consolidation with larger health systems, practices or services being reduced or closed. And some physicians limiting the number of Medicare patients they can accept, potentially leaving patients with fewer choices and less access to care. Ultimately, physician reimbursement can become a patient access issue. Now, Congress is considering a bipartisan bill called the Patients First Act, which proposes some significant changes to the Medicare physician payment system. There are 4 major reforms worth knowing about. Number 1, Medicare physician payments would receive permanent annual updates tied to inflation. Number 2, to make Medicare payments to doctors for services more stable. Right now, if Medicare increases what it pays for one type of medical service, it may have to cut what it pays for another service to make up the difference. This bill would make Medicare payments for services more stable and predictable for doctors. Number 3, it would replace MIPS. If you're a physician, you're probably very familiar with MIPS, the Merit-Based Incentive Payment System. The legislation would transition away from MIPS over 5 years and replace it with a new quality measurement system called points to make quality reporting more clinically relevant and less burdensome. And number 4, the legislation would make changes to alternative payment models and create additional support for independent primary care practices. There's another reason this conversation is particularly important right now. CMS is proposing changes that could lower what Medicare pays many doctors in 2027. According to the AMA, some doctors could see their Medicare payments drop by about 1.2%, while others could see a decrease of about 1.7%, depending on how they participate in Medicare's payment programs. Those are proposed numbers. They are not final. And the Patients First Act is also proposed legislation. It has not become law. So nothing is changing for your Medicare coverage today because of this bill. But I think this is an important issue for both Medicare beneficiaries and healthcare providers to watch. For patients, having Medicare coverage is only part of the equation. We also need a healthcare system where physicians can continue to afford to provide care to Medicare patients. I'm Susan Jackson with Best Health Options, LLC. I help make Medicare and health insurance a little easier to understand. If you found this information helpful, please like this video and subscribe to my channel. I share Medicare and health insurance updates throughout the year to help you stay informed. I'll continue following the Patients First Act and the final Medicare payment decisions for 2027, and I'll keep you updated as things develop. Thanks for watching.